Another study that we are presenting based on the GELL platform is understanding how CLL is treated, and managed in Latin America. So Dr. Valverde, she's a colleague of ours that has been very interested in understanding a little more about CLL. So we were able to collect over 400 patient data in CLL, and that's interesting because CLL is actually not very common in Hispanic population. So being able to amass data from about 400 patients was really impressive. In that study, what we could see is that the way we treat patients in Latin America is essentially with chemoimmunotherapy. And the main reason for that is because we don't have a lot of access to these new molecular agents like BTK inhibitors or BCL2 inhibitors. So we actually separated the treatment of these patients in different periods. And before 2016, it was all chemotherapy or chemoimmunotherapy. And between 2016 and 2019, we started seeing some entrance of BTK inhibitors. By then, the guidelines in the United States already included BTK inhibitors, but the usage in Latin America was less than 5%. And more recently, I would say in the last 2-3 years, we have seen an increase in the use of these agents to about 20-25% of patients. However, when we look at the American data, it's almost 100%, or very close to 100%, the use of BTK inhibitors or BCL2 inhibitors in this setting. So there is definitely an unmet need of getting access to these agents, and obviously has to do with the cost. These are actually very expensive medications, and most of the patients in Latin America get their medications from the governments, and the government sometimes want to cover the cost of these medications, and so the few patients who can actually get exposed to these treatments that are expensive are patients who have private insurances, or they have means to be able to cover this. In addition to that, we know nowadays that the most important prognostic factors in CLL are actually genomic in nature. We do have deletion 17p or TP53 mutations. These tests are almost never run in Latin America. So when we looked actually per countries. Uruguay probably is the one that used the most of these agents, of these tests, about 70% of the patients. But when we go, for example, to Peru and Colombia and other places, Venezuela, for example, more than 80% of patients do not have this type of testing done. So I think this really gives us an idea that we do see CLL in Latin America. We do treat these patients the way we can treat them with the resources that we do have, but there's definitely a deficit in terms of molecular testing. There's a deficit on access to targeted agents, and I think that is something that we need to work as a group in the future so we can actually treat our patients better.